Welcome to the Mayor's Roundtable, hosted here in the city of Aurora. We have 6 amazing mayors from throughout Illinois joining us today for another Facebook Live discussion. I'm Clayton Muhammad with the Mayor's Office of the City of Aurora, working from the back end to moderate, and we'll turn it over to Mayor Irvin. Between these 6 mayors, they represent nearly 800,000 people in the state of Illinois. And when you look at the COVID crisis that has happened in the last month and a half, they've certainly been leaders in their community and throughout the state. So our conversation today is just about that. What's happening in their respective communities? What can happen in the future? How do we continue to work together to strengthen Illinois and to be all in Illinois? And so to introduce our guests today, if they can just wave, we have Champaign Mayor Deborah Feinen. Thanks so much. We have Joliet Mayor Bob Odeker. Rockford Mayor Tom McNamara, Springfield Mayor, the state's capital, Jim Langfelder, yep. Waukegan Mayor Sam Cunningham, and our own Mayor Richard C. Irvin, who has the distinction of not only being a mayor, but he, as we know all too well, has beat COVID, so he understands from a personal standpoint what this means to stay at home and to keep going forward strong. We'll turn it over now to the Mayor of Aurora, Mayor Richard Irvin.
How you doing, friends? First of all, I want to just thank, acknowledge these great mayors from throughout the state of Illinois that have joined us today on this Facebook Live session. These mayors are the people that deal with our society every day. Now, when we think about government and we think about, the president, you think about the governor, you think about, local municipalities, it's the mayors that make a difference. We make sure that your taxes are low. We make sure that your streets are shoveled in the wintertime. We make sure that your garbage is picked up. We make sure that we deal with everything that affects your everyday life. And these are the mayors throughout the entire state of Illinois and of large cities that help affect our citizenship throughout the benefit of our citizenship throughout the state. So again, thank you guys for joining. Today, we're on talking about the COVID issue. Again, it's a crisis that, affects our world, our country, our state, and our individual municipalities. And we're just trying to, figure out the best way to deal with what we're recognizing as the new norm. Look at us now. I've been in rooms shaking hands with all of you, all of us together. Now we're in communicating effectively, at the different meetings we'd be at, especially Illinois Municipal League meetings. And now, we're communicating via, Facebook and video. And this is probably, as we talked about a little bit earlier before we went live, this is probably how we're going to be running our governments, to some extent for, at least the next couple months, because until we get a virus to address this coronavirus and the issues that it presents to our community and to our community's health, this is what we're going to have to be dealing with. I can say from Aurora's perspective, this has affected us greatly. I would say for the most part, our citizens of Aurora have stepped up strong, and we say we're stronger from home. We're strong together because we're going to make a difference. But there are those out there that don't recognize the seriousness of the COVID-19 and what it can do to you. Now, I'm a person that was diagnosed and can tell you firsthand, this is not a nice virus to get. It doesn't treat you nice at all. You feel terrible. And I went through heck. I like to say I went to the edge and back. But working together, we can make sure that our community members, our families, our mothers and fathers, our sons and daughters.
Order. And we immediately started getting city staff out of, the city building, non-essential staff. Of course, our first responders who are doing an amazing job continue to have daily contact with our public, but we have really changed around most of our processes and encouraged social distancing and the processes that do require one-on-one, like inspections for building permits and things like that. We've also been lucky with acquiring PPE and been able to feel like we have what we need for that. I think probably our numbers in Champaign County are low. And one of the reasons they're low is that, the university made the decision to send students home after spring break and not have them return to our community. That'll be a different discussion when we talk about the economics, which I know is coming, because that certainly is impacting our economy. But it's made a big difference in our numbers, as well as our citizens taking the stay-at-home order seriously. So we are at 96 cases for Champaign County, which is fairly low. We have 13 active. We have 79 recovered. We have 6 who are currently hospitalized, and we have 4 who have passed away. We're at about 2,000 tests, but like you, Mayor, we are ramping up the testing as tests have become more available. Our federally qualified health provider, Francis Nelson, is now a testing site, as well as the hospitals. And our public health district continues to track our numbers. So I'm really proud of our community. They've done a great job, and we're in it for a longer haul than I think people wanted to be. And I know that that's hard, but our community's doing a great job.
Great. All right, let's go on to my brother down in Joliet, Bob Odekirk, Mayor Odekirk.
Thank you, Mayor. Thank you for putting this together. One of the things we've done in Joliet is we have done at least once a week press conferences locally, and I've always got a real positive feedback. I think people are looking for information and accurate information, not just things that are appearing on social media. So thank you for putting this together, for all the other mayors taking time out to participate. I think the Joliet story would be similar to what was just described in Champaign. We closed City Hall to the public. We've done what we can to separate essential employees so they're not all working together. Some are at home, some are at City Hall. Our first responders are working. They have proper PPE, but that's been a challenge to get to continue to bring in PPE. I think the two issues in Joliet that might be a little different than what others have experienced. Number one, a couple of weeks ago, we had an issue with Stateville Prison. There was a pandemic outbreak at the prison, and per Department of Corrections guidelines, all the prisoners were taken to one hospital inside Joliet, St. Joe's Hospital. So within a 24-hour period, the hospital was in danger of being overrun. Besides the prisoners, all the Department of Corrections personnel that had to be there with them. And the hospital director was on local media. He called it a war zone. But the governor's office got involved and immediately, within 24 hours, began taking patients and moving them to different hospitals throughout the state. The National Guard was deployed. They set up a MASH unit on the ground of Stateville. So that was a close call with St. Joe's about to be overrun, but I really give Governor Pritzker a lot of credit. Him and his team were very dynamic in getting involved in this and solving the problem. So as of last Friday, last time I had spoken, there's 2 hospitals in Joliet, St. Joe's. Silver Cross is just outside of the city. Their numbers, of course, are varying day to day, but both of them are about 70% capacity for COVID patients. They're both reporting either 18 ventilators available or 25 ventilators available. The city has talked to different agencies, the Joliet Park District, Chicagoland Speedway, some others about a second hospital site if needed, but we have not seen that in Joliet. Our 2 hospitals have been able to cover this, knock on wood. The Joliet Fire Department is reporting they were doing, about a week or so ago, they were averaging 30 new COVID patients a day that they were handling, and those numbers seem to be dropping. It's about 20 now. So it does seem to be trending in the right way, at least for now. The other negative thing, which is troubling, and this has been in the Chicago media, is the outbreak that we've had now in 2 Joliet nursing homes. There's a lot to say about that, and I'll go into more detail if someone wants, but I can say locally, we were not tracking these numbers at all. These are private nursing facilities that do not report to the city of Joliet or to the Will County Health Department. They report to the Illinois Department of Public Health. The Illinois Department of Public Health over the weekend is publishing all the numbers. So I thank them for their transparency. There's issues here, and I'm hearing a lot from family members of people either in the home or people who have died in the home, some tragic stories. But it's a little troubling. The hospitals or the Joliet Fire Department, their numbers are not matching up what's being reported from the nursing homes. So it would appear, at least in the case of one of these Joliet nursing homes, that a lot of people were dying inside the nursing home, which is located about 3 blocks from St. Joe's Hospital. So, yeah, there's things, and again, I've been in touch with the governor's office regularly. They are essentially doing triage right now, trying to get a handle on the problem. But yeah, there are some issues there, and you know, I'm concerned obviously for the people who have passed away, for the people who are sick. I think there's another 18 or 20 supposedly inside the home that are sick with the virus. There's workers there who have had the virus, who have succumbed to the virus. But apparently the first cases are going back to January or February, when none of our first responders had the protective equipment. So theoretically, Joliet firemen or Joliet police officers were being sent in there and not knowing what they were walking into, and they didn't have the protective equipment.
Exposed, exactly
right. So I think we all would agree this isn't about throwing stones at anybody. This is new, and we're all handling it on the fly. But this has been a little bit alarming, this issue. And it's not over. I think there's more going to evolve with this. But and hopefully, I said last night at our council meeting, I know of a nursing home in Willowbrook, I think, and now 2 in Joliet. And it's hard to believe that we would be the only ones having these problems with seniors who are at risk and who are not healthy, all in a confined area, that this can't be hit in other nursing homes throughout our community. So,
Mayor Odekirk, I expect that that's absolutely the case, and we've got some similar issues here in Aurora, and I bet we have similar stories throughout our state. It's just not being reported because of the private nature of the nursing home. Let's go on to Rockford Mayor, good buddy Tom McNamara.
What's going on, Richard? So thank you for putting this together. Things here are somewhat similar to what I've been hearing across the board here from the other mayors. We stood up our emergency operations center now just over 8 weeks ago. I think one thing that's been really impressive is to see the collaboration there in that emergency operations center. And I think what Mayor Odekirk said, no one's to blame. We're all in this together. And I think seeing that from the mayor's level, even during these crises, has been really inspiring and gives yourself a sense of hope that we will get through this together. Here locally, we have 222 cases. Tragically, we've had 11 deaths. Similar to what was mentioned previously, we are seeing more and more cases out of long-term care facilities. And also very concerning to us is we're seeing more and more cases from our essential workers. Those folks who are on those front lines, if it's grocery store clerks, if it's a nursing home staff. So that is very concerning to us and something we're monitoring very closely. I would say a couple of 3 other points is the collaboration we're seeing is awesome. From you look at financial institutions, when this first hit, we brought 8 different financial institutions together to create a rapid relief fund for small businesses. This was before the federal government started pushing out funds through the SBA. We wanted to get in there and create a fund to help them bridge that gap from when the crisis started and the stay-at-home order to when the SBA program would come through. And seeing some troubling issues with the SBA program, we're happy that we started that initiative. Other is the collaboration of all 3 health systems. We have 3 major health systems, plus a community hospital and Crusader Clinic. All of them, every single day, I'm on the phone with a joint meeting with all of them, and they've just been doing a tremendous job to create really one health system for the entire city, which has been, again, inspiring to see. I would say the other things that we all get to see every day, even not in a crisis, but is illuminated during a crisis like this, is those quiet heroes. Those quiet heroes who every single day are doing amazing work, but during this crisis, they're helping seniors, pick up groceries. They're creating and delivering free masks and face coverings to individuals who may not have the means or the ability to get those. Seeing that every single day, it's hard not to be inspired by those folks. Helps you keep going, especially during long, busy days. You touched on testing. We too will be standing up 2 more additional testing sites. We're hoping to have between 1,000 and 1,500 tests being done per day. Right now, we just have about 1% of our entire county that's been tested. And so we're getting that same pressure that we all are getting, that, hey, we have such low cases, let's open up everything. But the fact is we have very few that have been tested. because it hasn't trickled down the way I believe it should. So we're stepping up to that challenge, as it sounds like all of you are. So I think many of the challenges we're facing are very similar.
Absolutely. Let's go on to my brother over in Waukegan, Mayor Sam Cunningham.
Good afternoon, everybody. Thank you,
brother.
Mayor, for putting all this together, of these frontline leaders that sometimes don't get the credit that they deserve because the media attention is not always on us. But within our prospective communities, you're seeing, at least I am hearing what we are doing to make sure the level of service that's expected from our residents, it continues to go on regardless. I think we said earlier, one of the things we said earlier, one thing, people know how to call. They know how to call the mayor of Waukegan or the mayor of Rockford, Aurora, and such. And we don't shy away from that. So I think this is a grand opportunity to show that our leadership is the reason that we are in these prospective seats today. And I'm up to the challenge. For as far as Waukegan is concerned, we can go on, and I think you're gonna have the same kind of response from all of us. We are trying to do one thing, and I call it stay in your lane. Do our police, do our public works, do our fire, do our city service, and for us, it is water service. At the same time, look at the level of service that we provide to small businesses and other business partners. The things that I like to just give a huge shout out, and it says before, is those essential workers and what we call non-essential workers, but are doing the job that it takes for us to get through this thing together. There's clearly that our police department, fire department, public works, all of our hospitals, and I'm gonna go out on a limb and say all of our healthcare providers, whether they're small or big, whether it be Vista Health, Lake County Health Department, just those neighborhood doctors, they're all stepping up to do what? To make sure that all of our citizens throughout our prospective communities are getting the healthcare that they need. And we talk about testing and numbers. Right now in the city of Waukegan, numbers throughout the county, I'm at about 600 cases. Now, it's called self-reported now. And I think you touched on it earlier, Mayor. I don't know if everybody's reporting or they just haven't been tested. One of the frustrations for all that we are having is, one, the test kits there's not enough. Two, they have not been disseminated down to us locally. Three, getting the test results back in a timely fashion. These are frustrating things for us. And then it leads to that frustration to all of our residents for us to come up with answers. While we try to come up with the answers, what we're trying to do is make sure that we're doing the things that's necessary, that's in our control. And I think we all have some of the most amazing staffs who are doing that, from your police, fire, public works. I think all of our CFOs are gonna be the most liked person on the face of this earth when it comes to calculating what is necessary to cover these expenses, and then disseminating that information down to our legislative bodies, our aldermen, a commissioner. That's one of the things that we really pride ourselves on, getting the correct information out, not only to our legislative bodies, but to our extended communicators, neighborhood watch groups, these block party groups, these civic organization that helps in disseminating correct information so our constituents are not confused, but more importantly, not scared. And sometimes they get scared when they hear death. They hear an abundance of cases. We have to make sure that we give them the correct information and let them know we're making the best decision that's humanly possible to make sure that our communities move forward and we can push through this crisis that we're in. I want to send a huge shout out to International Medical Corporation, our Lake County Health Department, AbbVie, and the governor's office. Just recently, the International Medical Corp brought in and set up a portable hospital next to our regional hospital, right, located in Waukegan. And they're donated a full-blown hospital. I think it's similar that was set up in Joliet. All the equipment not only is going to be there to help the overflow of patients if and when they come, but more importantly, that all of that ventilators, the portable hospital will be donated to our community. And that was spearheaded by Mark Fisher, Lake County Health Department, the governor's office, and AbbVie. I mean, this is the Waukegan, the Illinois that we all know, that we know is in us, but it takes crisis to bring it out. So I'm just excited that I'm on the line with such leaders who are taking sometimes a back seat and a lot of criticism sometimes that we're not doing enough. But when we're on the phone call every day like today, talking to our staff at 3 to 3:30 every day after the governor's press conference, talking about how we can make sure that we are providing that level of service to our residents and to each other. So that's the excitement that I have, and knowing that there is a silver light at the end of this tunnel, and we're going to get through it, all of us together.
Absolutely.
I think Zoom is going to be the best way to do it nowadays.
It's the new norm, brother.
Thank you very much, man. Thank you very much.
Absolutely. And let's finish up with our state's capital, Springfield Mayor Jim Langfelder. How are you doing, sir?
Good. Thanks for putting this together, Mayor Irvin. I really appreciate it. And I enjoyed Mayor Cunningham. I have fond memories of Waukegan. Actually, I spent a summer there as a young boy when my father, he worked for an engineering firm. I think it was Crawford, Bifford and Tilley at the time, and he served a summer there. So, and that's really the difficult challenge for all of us. It doesn't matter where we live. It's the changing dynamic, what the coronavirus has done to our lives. I've come from a large family. It's all about togetherness. And this really challenged our togetherness because we're socially distant, but how do we pull together? And our people are our greatest assets. So it doesn't matter what community we're in, what city we represent. And that's the joy of being a mayor, whatever city you're in, because you represent people, and that's what we're all in it together for that reason. But for us in Springfield, a lot of similar stories with regards to testing. It is frustrating. And this has been banted around for months, a couple months, and we're still discussing lack of testing. I think the real number that I always harped on is the unknown, and that's the individuals being treated at home. I think that was a number that should have been shared more frequently, because people would call in and say, I have a headache, I have a fever, it's been going on, I have a backache, and similar symptoms, but they didn't fit the algorithm for the actual test because there are so few. And so I think that's a misnomer number. And so we preached, thankfully, Governor Pritzker was ahead of the curve. I think he did the stay-at-home order probably earlier than New York, had a lot of parameters in place. And I think that helped throughout the state of Illinois, but specifically in Springfield, because we were trying to adhere to that, moving that direction where you make sure you wash your hands, make sure you keep your social distance, and moving in that direction. And so with the stay-at-home order, that's helped. We have 2 level 1 trauma centers with Memorial Health Services as well as HSHS St. John's, and they represent other bedroom communities and counties around this area. We're like a regional provider for healthcare services, and how it's structured, as you all know, but for our public, it's the Illinois Department of Public Health because it's a emergency health crisis. And then each county has their public health department, or we used to have one in the city. I'm not sure how you are, but wherever the public health department is located, that's the driver for your area. And so for us, we have testing for bedroom counties as well. We had Taylorville, someone mentioned, I think it was Mayor Rodekirk mentioned about the senior centers. That was one of the first areas as a bedroom community in Christian County. They had a breakout of in a senior area with, I think it was less than 10, but tragically a death or 2 from that. And then we had one just last night from a bedroom community of Sherman within Sangamon County. And they had 7 cases right there. 4 of them were employees. So that's serious for ourselves in the county. We've tested 1,300. We've had 66 positive cases. 31 have recovered, but sadly 5 had passed away. So that's a challenge for each and every one of us. How do we pull together our community? And for us, it's always the drivers, our healthcare community. No offense, but I think it's second to none with the services we provide. They all work together. For ourselves is how do we make sure we tear down the barriers of operation, because regardless of the government structure, we all have to work together. So for myself, I appointed Chief Alan Riney, Fire Chief Alan Riney, as our coordinator of our services for the incident command team. And he helped put the whole structure together, even though it was run by the county. Here's the chief of the Springfield Fire Department, which is a Class 1 entity. There's only 3% in the country. He was the lead entity or lead representative to put that whole structure together with the incident command staff. But really what's important for everybody to realize, someone told me, and this is true, being a mayor is like drinking out of a fire hose. Being a mayor during a pandemic is like 100 fire hoses, because each day is different. You just don't know what the challenges are. When we started out, it's all about delivering services. We have our own utility. How do we provide electricity and water to the public, as well as our roads, public safety as fire and police? Those are the core entities. But how do you assure that and assure a safe workforce, especially with the stay-at-home order? So we had to stagger the workforce and provide those services. So we appreciate the work everybody's done, especially our first responders and our healthcare community, because I have a lot of relatives that are in the healthcare industry, nurses and doctor, and really they're putting their lives at risk so we can be safe and healthy. And so what we need to do is adhere to the compliance of staying at home as much as possible, only going out as needed or when needed. It's not when you want to go out, only when you need to go out, and keep that social distance and be sure to wash your hands as frequently as possible.
Thank you, sir. Mr. Muhammad, is there, what is the next subject?
Definitely. This next half of the conversation, we're going to look at two different categories. One, economic losses, and the next, reopening the economy. And this is where the questions and the comments are leading on social media. So thanks to everyone from throughout the state for watching. First, this week, more than 10 mayors came together to send a joint letter to our representatives in Congress, our senators and our representatives, asking them to fight for flexible direct funding to municipalities to help limit the crippling economic damage to our cities. Let's talk about how much each of your cities stand to lose as a result of this pandemic and why this letter was so important at this time. Mayor Irvin.
All right, first let me say I'm on a organization called Illinois Municipal League, IML. And as part of that organization that reaches throughout the state and brings all the mayors throughout the state together, there's a large cities roundtable. And myself and Mayor McNamara both chair this large cities roundtable of every city, 75,000 and more. And Mayor McNamara, called me and says, look, as chairs of this large cities roundtable, we got to bring everybody together and talk about how we're all being financially affected by this COVID-19. It's nobody's fault, but the reality is we still have to address the issue of the holes that are going to be put in our budgets. And that prompted us, sending that letter that Mayor McNamara talked about, and us coming together today, throughout the state to talk about the issues. Now, let me just set the stage of that. Sometimes people don't know how government works. We rely on businesses to function so we get our income and revenue. For example, we get revenue off of sales tax for when you go in and buy, a beer, or you buy a hamburger, or you go to a retail place and, you buy a shirt. So or we get our income off income taxes, and we get our income off property taxes. So it comes a lot of different ways. So in this particular case, with COVID-19, and we have this stay-at-home order, which it shuts down pretty much the whole state, and rightfully so. We've got to fight this this coronavirus with every tool we've got. But what happens is when, for Aurora's perspective, we shut down our Fox Valley Mall, which generates billions of dollars a year. Matter of fact, it's in the state of Illinois, it's only second to the Magnificent Mile in Chicago on Michigan Avenue. That's shut down, zero income revenue coming out of that. Our casino, and Mayor Oderkirker understand this coming out of Joliet, our casino is shut down. We're getting zero income. We got millions of dollars from that a year. Our premium outlet mall, which is one of the most successful outlet malls of its kind in the state of Illinois, shut down, zero revenue. Our Paramount Theater, which was a huge draw for the city of Aurora, shut down, zero. We're getting zero revenue. Matter of fact, our property taxes, the counties are working with our citizens, and rightfully so, and saying, all right, if you can't pay your property taxes by June, we're going to give you an extension for 30 days to 90 days, which affects a local municipality's budget. We don't get property taxes. That's millions of dollars that we don't have to pay for police and fire and, and run city services. And income tax. The state says, you don't have to pay your income tax on time by April 15th. We're going to give you a 3-month extension. Well, that's less money that comes to a city. So if you take all this revenue away that the city normally gets year, we have these projections of how much revenue we're going to get, and you take this money away, it messes up our projections. Matter of fact, not only that, it puts this big hole because there's this 3-month period where our cities have generated absolutely no revenue, which means no income to the city. So then the question becomes, where do we get money to fill that big hole? And this is where we're asking the federal government. We don't print our own money here at the local level. We don't print it at the state level, and we don't have the trillions of dollars that can help, our state. So we're looking to the federal government to give some assistance. And again, this isn't about, blaming the blame game. This isn't about saying this is somebody's fault. This is about asking how the federal government can help these municipalities. We've often heard many times that all government is local. I talked about it a little earlier. The mayors, police, fire, water, garbage, snow removal in the wintertime. All this stuff that the average everyday person, starts to expect in a city that we all provide as services. This costs money. And if this money doesn't come through our, normal channels and income through our revenue, then where's it going to come from? And that's where, Mayor McNamara said, look, let's get together and get on this letter and talk to our reps in Congress, talk to our 2 state Senate, U.S. senators, and let's try to get some help. And let's try to see if these, if in one of these bills, stimulus bills, they can actually look out for the municipalities that make up all the states, that make up the state of Illinois, that make up every state. It's municipalities like ours that make it up. So, I'll kick it over to my brother, Tom McNamara, and maybe you can go a little more detail about this letter, brother.
So appreciate it, Mayor Irvin. One, I would just say I'm really proud of when you look at the individuals here and those who signed the letter. It's a bipartisan group.
Absolutely.
In total makes up 1.2 million residents, representatives of 1.2 million residents. I would say a couple of things. One, I don't want anyone to think that this letter is a shot at anyone. I think this is us sticking up for our residents and the services we know they need and depend on. You look at Senator Durbin, Senator Duckworth, in my opinion, they've been very proactive. They certainly are fighting for municipalities to receive funding. My own Congresswoman Sherry Bustos has been tremendous, contacting me, asking what she can do to help fighting for municipalities. I think not only is this important that we got this letter out to all of our federal legislators throughout the state, but I hope federal legislators across the country from Lexington, this is not an issue that just mayors in Rockford, Illinois, or across the state of Illinois are dealing with. I mean, mayors in Bakersfield, California, and mayors in Lexington, Kentucky are all dealing with this issue. I thank the federal government for assisting higher education. I thank them for assisting airports. I thank them for assisting public transportation. I thank them for assisting small businesses and providing stimulus checks. But when you look at, and every one of us has said this in one way or another, when you look at government, mayors and municipalities are the front line of government.
Absolutely.
We are taking care of, and the federal government is taking care of the front line. They need to take care of municipalities at that same level, because the idea that they would put this onus on local municipalities when it's, you hear the words first responders, you hear the words small business owners. They use those terms at the federal level. I think all of us use it as our friends, our neighbors, our family members. We are close to them. We see them in the grocery stores. We shop at the same malls as Mayor Irvin mentioned. These are our community. And the idea that the onus would now come down onto them after they've done such an unbelievable job of being the heroes during this pandemic, I just don't think is acceptable. And I know many of our Illinois legislators believe that as well. And I just hope that this letter brings some attention from not just Illinois, but across the country to put some pressure on the legislators who have not yet seen the light that helping municipalities is absolutely critical. I mean, you mentioned this, Mayor Irvin, we don't print our own money. We, by law, have to pass balanced budgets every year, so we can't wait a year and delay and have a 2-year budget. This is stuff where the rubber meets the road. We have to do these things, and we need the federal government to stand up and help us. I know from my standpoint, I have yet to sign a letter like this to all the legislators in the state on any issue. And I think it's just because this is such an unprecedented issue that if you're a Republican mayor or you're a Democrat or you're a nonpartisan, we all are facing the same challenges. And we're trying to do this to face them together so that we can benefit our citizens and not, again, put more onus on citizens' backs. So thank you, Mayor.
And let me just throw that, if you know that dollar amount, we're looking at about a $30 million hole in our budget if we don't open up by sometime in the beginning of June. What dollar amount?
Yeah, great point. We're at 14 million. We're at 14 million right now, and growing.
And let's go to Mayor Feinen. What are you guys looking at as far as down in Champaign? What are you guys looking at as far as effect from the COVID-19 financially in your budget?
So we will be at about 11 million if we open May 1. So know that number will continue to rise. And, you know, as I mentioned earlier, one of our bigger impacts and absolutely necessary to keep people healthy, but the university has decided to do online classes through the summer. So we won't have students returning back into our economy, at least until the fall. You know, we have some here, we have some that are in apartments and sheltering in place here, but a large part of our economic driver is the University of Illinois. The other large economic drivers for us is healthcare. And as everybody knows, healthcare is actually losing money during this pandemic. So one of our local clinics has furloughed, I think, over 200 employees while this is going on. There's no non-essential surgeries happening, and so that's been dramatic as well. So we continue to work with the budget that we've got. We will be okay through the end of the June 30 budget, right? We all start again July 1, but planning for that next budget year becomes very, very challenging. And, I think as we would all acknowledge, we're going to be asked for more and more services as our small local businesses need help, as our citizens need help, whether that's with food or shelter, whatever that may be. They're going to look to their local municipalities for that help. And we are not going to have the funds to be able to help in the ways that we want to.
Absolutely. And you're talking about, Mayor Feinen, that's additional help, based on the COVID crisis. We still got to provide the services that we'd always been providing up to this point, which requires a balanced budget. Mayor Cunningham, what kind of deficit you guys looking at?
One thing, I'm telling you what we did. We had already had a budget already ready. So we passed what is called a pre-COVID-19. It was a balanced budget, sound. We also put in there that we're going to be coming back around August, September, once we truly understand. That's what the hopes of May 1 is active, or maybe June. So we'll see, at least gives us some type of game plan or approximate of where we're at. As far as revenue losing, we're probably right around a $10 to $12 million loss of revenue. Mm-hmm. How that would trickle over to a budget deficit, we can give a number, but I'm just here to tell you these are unprecedented times that require that we've never in history of our governments, whether it be on the national level, state level, or local level, has never even dealt with loss of revenue or loss of taxes in at this form. But I will say is this, for all of us, there's a new word out there called net neutral. Net neutral means, and that's almost as good as gaining, getting new revenue. Net neutral means, for those who are listening, that it didn't cost the city nothing, but we still were able to provide the services that's needed. That's net neutral. And that is something that we are really incorporated into our mindset. And how we've done that, we've put together 2 systems that says, hey, we're gonna start documenting what it costs for that public works, for that ambulance, for that police officer to process that bill. What does it cost per person? Put those lines up there, mirror that with what we need to take in. That's gonna be a true cost. And it goes to your point earlier, sir. No one really understands government, particularly how we get revenue in. We get revenue in by one means and one means only, and it's not through Coca-Cola, increasing the cost of a Coke so we can get more revenue. We get revenue in through our property taxes, income taxes, sales taxes, fees, and God forbid if we get some net neutral state governments, state grants that we don't have to pay back. So using those deals and making predictions of what it costs us to provide the level of service that is expected from our residents, which they should, that's what we're trying to do right now. But from a loss of revenue, we're in easy $10 to $12 million within the city of Waukegan. And that's just to provide the basics: police, fire, public works, or water. And I don't have a hospitals under my control, or the public school system. We haven't even talked about that within our government, but we are hurting. So making sure that our national legislators understand, when you give that release to the business, when I see on MSNBC that the steakhouse got $20 million, but yet the cities that provide the needs for those folks to go to that steakhouse can't even get included into the bill. That's troubling.
That is troubling.
When you're talking about we're in phase 4, our residents can't wait for the police to come in phase 4. They can't wait for the fire department to come in phase 4. We need it now, or a good understanding that you hear what we're saying.
Exactly.
And this is why it's so important for all of us to collectively send that 1.2 million constituency letter, so they'll understand we're just as an impact as, and thank God we have Chicago as a Chicago metropolitan city, but we're on the front line here in these suburban areas that help our communities live the way they need to live.
Absolutely.
I heard Shake Shack's giving money back. I'll take their money if
yeah.
that 10 million. Wait, what do you think, Mayor Odekirk? What kind of pain you feeling down in Joliet?
Well, like everyone else, it's significant. We had called a special budget meeting last Tuesday, and the council convened. I had the city manager and our finance director just kind of lay it out for us. So we're going to have a better idea a couple months from now when we see what revenues aren't coming in. But our annual budget is about $280 million a year in Joliet. And right now we're estimating we've lost about 70% of those revenues. Wow. So, you can't cut your way out of that. No. We're tightening the belt. We went back to department heads, but those numbers just can't be replaced. The revenue has to come in. With the riverboats alone, we're losing about $300,000 a week. With those being closed.
And you've got 2. Yes, that's right.
We have 2, and because of, I think seniors are the big clientele and the proximity, I think it's a long time before those are going to be opened, or if they are reopened, to operate anywhere near the way they were operating before.
Absolutely.
So, it's, we had a healthy reserve fund in Joliet. We're using that. We had a significant amount of cash in a water fund that we could borrow against. But if things don't change, we figure we could stay viable until September, October.
September is the month.
And obviously, everyone's hoping that there will be some rebound and things will start up again. But that's what we're looking at here in Joliet. It's hard to say where we're going to come out of this or how long it's going to take. But
absolutely.
I always forget, Mayor, that you guys have 2 casinos. Me and Sam are just trying to get one.
And Mayor Langfelder out of Springfield, what kind of pain you guys feeling down there, brother?
Well, we have a large hospitality. That was the first hit. We usually enjoy a 70% occupancy rate with regards to our hotels, and it's below 10%. So we've had $15 million of economic impact canceled because of conventions, things of that nature. But looking at our budget, we asked directors to just pare back 5% of the budget. So that will help somewhat. We've done stress tests at show a range anywhere from $6 million to $16 million. It just depends on what the variables are. And that's the one thing with the coronavirus is each day is different. So we were dealing with the unknown and trying to prepare for the worst case scenario. So it'll be a definite if there's no assistance. And, thankfully, to your efforts, the Illinois Municipal League, U.S. Conference of Mayors, the congressman in our area and the senator, I know Durbin and Duckworth, they're supportive of the municipalities because, Senator Durbin's from here. And so we really appreciate their level of support on the federal level, but that is a challenge. And where do the dollars come from? And they're no different than us. We still have to pay for it. So where's that money coming from? So from our perspective, thankfully, the Paycheck Protection Program, we've done over $200 million in loans due to our community banks. So that dollars have gone out there, but it is frustrating that the support's not there yet. I think we haven't seen that as of yet, but it's important that it doesn't matter if you're at the federal level, state level, they all need to take a role from the local level that you do put the partisanship aside and figure out what needs to be done and make it happen so you can provide the day-to-day service that the people expect to receive. We're the home of Abraham Lincoln. It's all about government of the people, by the people, for the people. Doesn't matter where you're serving, that's what it's all about.
Absolutely, sir. Now we're coming up on our time. This has been a good conversation, but before we end, can we take a few questions from the media, from viewers, Clayton?
Well, you guys are answering a lot of the questions just in your conversations from our media. So we're going to check it off as we go. That last category, Mayor, however, is really looking at reopening the economy, what that looks like from your perspective. Collectively, the mid-sized cities who signed the letter stand to lose 120 million plus in revenue. The governor stated the peak in Illinois for COVID cases isn't until mid-May, and he'll be making adjustments to the stay-at-home order. So the question, a number of questions from the media and the community, what kind of adjustments do you think is necessary for your community to maintain balance between public safety and gradually reopening the economy? What does that look like for you?
Let's start out with Mayor Odekirk there.
I really would defer to the CDC and what's being said by the medical professionals. I think one thing, Mayor Chirico wrote a letter I read on Sunday in Naperville. We do know more about the virus now than we did a couple months ago. I think we have a good idea who's at risk. So maybe that moving forward, we have a mind on who is at risk and who is the most vulnerable versus people that again may have the antibodies or may be able not be at high risk and put them back out. But I mean that's a tricky call. It would appear to Mayor Feinen or Mayor Langfelder that the situation downstate probably is a little bit different than in the Chicago metropolitan area. So, and I think Governor Pritzker has made some comments about that, about maybe treating different regions differently. And I think that might be the way forward. But I do think it's imperative, keeping public safety foremost, that we start getting the economy rolling again. To some level, everything we could do. I don't want to take up all the time. We have a number of construction projects in Joliet or in the area that is still going. So it's good to see that the tradesmen are out working. I think it's important. And any facet that we can't push out, I think we should try to do if we can do it responsibly.
I'll jump in there and follow you up, Mayor Odekirk, say that what it's going to look like for all right, so we have made our budget based on, or our projections based on opening June 1. So, if we open June 1, what's it going to look like in our community? Well, I think it's going to be slow because the reality is we don't have any type of vaccine yet, or any type of mitigating cure or mitigating medication that reduces the seriousness of the COVID-19 symptoms. So it's going to be slow. People aren't, as you pointed out, Mayor Odekirk, people aren't going to be rushing back to the casinos. People aren't going to be rushing back to the theater to sit right next to each other, 2 inches away from each other. People might not be rushing back out to the malls where folks are congregating in large numbers. I mean, we're human beings. That's how we've always functioned. We congregate with one another, but it's going to look different when we go back. We're still going to have to practice social distancing. We're probably still going to, have to wear masks until we get, some type of vaccine or, know a whole heck of a lot more about COVID-19, which our experts are saying, if we get a vaccine, it won't be, another 12 to 18 months from now. So it's going to look a lot similar to what we're doing now. We'll just be out and about in the community, and many of us back to our jobs and back to, in our cases, running government the way we had been before. But there are going to be a lot of things, and it's not going to look the same. There are going to be a lot of things in place in Aurora, and I'm sure Joliet and you know, Champaign and Waukegan and Rockford and Springfield. You know, it's going to look different. You know, and we as mayors have to do the best that we can to make sure that although this is the new norm, that it still functions and works and makes our cities go forward. Let's go to Mayor Springfield. What do you think there, Brad?
Yeah. I believe there will be an extension to mid-May, but that what we're looking at is making recommendations on there's certain businesses that have tried to operate under the current parameters. I think that's important to communicate that to the governor's office so they can take a look at it, because when this started, where the information we have today is a lot different from back then. So I think if businesses like the barbershop or the florist, if you can, and small retailers, they were kind of operating, we had to put a halt to it, but they can do it keeping the social distancing in mind, where you can have a pickup, not come in contact with anybody, or delivering that services by wearing gloves or masks or what have you. I think that really needs to be taken a look at, because we won't be able to flip the switch whenever it comes back full force, where the stay-at-home order goes away. So we need to take a stair-step approach. And if it is extended, hopefully the governor, I'm sure he's relying on the healthcare professionals, take a look at, okay, what are the services right now that possibly could be put in place with businesses, as long as they can keep that social distance, guaranteeing that, and keeping the customer safe as well as the individual workers.
Absolutely. Mayor Feinen.
I think it's important that we have adequate PPE or even cloth masks available. We're doing a mask drive next week in Champaign for essential workers. But as we start to open up additional businesses, we need to make sure that they have access to what they need to keep their employees and the customers safe. So I think that's really important. I think compliance, I've been in places where people will say, oh yeah, my employer supplies it, but I just don't want to wear it. That, you know, so people need to be aware and they need to comply. And then I have to give a plug to the University of Illinois. We had people here who quickly developed a ventilator product. Wow. And they're, you know, it's in testing phases, but it is a less cumbersome than our ventilators that we are currently using, can be used specifically for this COVID event. I am sure that they are doing all sorts of other research relating to antibodies and vaccines. And I know that not only through our community, but, you know, through our nation, that we have the ability to provide the science that is necessary to beat this. We just are going to have to take it slowly and make sure we take care of as many people as possible as we reopen the businesses.
Now let's ask one. Thank you very much, Mayor Feinen. And let's, Clayton, are there any other questions on any other subject out there? And I'll have Mayor Cunningham and Mayor McNamara answer that last question before we wrap up.
Well, there is a less dense area that we're dealing with in central Illinois, like Mayor Feinen has pointed out in Rockford. So that's a little bit different. I think you'll have to take a look at it as we move forward. Each place is different, but we are a mobile society, and how does each area impact each other? So it's important that we do retain that compliance, and that's going forward, as you pointed out, Mayor Irvin. The distancing, the shake hands, that's gone. That's going to be our future we know for at least a year till the vaccine or is developed, or way past that. So time will tell, but it's important that we all do our part to be in compliance.
You know, we all shake hands for a living, so we've got to figure out some other greeting, you know, when we walk up and see somebody. Exactly. Clayton, is there any other question, Clayton?
No more, sir. These are being answered pretty well. Thank you.
All right, so I'll ask Mayor Cunningham, as far as reopening Waukegan, how does that look?
Well, I think one of the things, and I think the mayor from Joliet said it best, all of our communities, demographics are somewhat different. And so it requires a different method of how we do it. However, there should be basic guidelines. And I think that's where we're going to use the CDC, the president, Illinois Department of Public Health, the governor, and in the Lake County or Waukegan, our Lake County Health Department, making sure we establish some guidelines that are similar throughout the state, or certainly throughout the county. But for me, what it looks like, what I perceive for it to look like is this. I like to say, if a particular building has 10,000 square feet, looking at the social distancing requirements, how many customers can come into there? And one of the things we're doing as we speak right now, that I'm going to be signing an executive order that all of our essential places of business, their employees must have a mask on. We're going to be signing that today. And then we're going to also, part of that executive order is encouraging all of the customers that come in to have a mask on. We're going to work with, matter of fact, I got a call from some of our car dealership, Classic, another one of our business here, Visual Pack, and a host of others who want to donate, whether it be hand sanitizers or mask, try to get to those outlets in our social services agency so they can do it. Can the city provide all of those things? That'll be a tough hurdle for us to try to do that. But if we work with our other business partners and where people go to get the things they need to handle their day-to-day living, then I think that's a little bit better. So that's going to be one of the ways we look at it, compounding or adding to what other ideas come from, our national and state leaders, where Congressman Schneider and Congressman Underwood, along with the two senators of the U.S., have been very, very instrumental in keeping us up to date, letting us know what goes on. But that's going to be my way of looking at what's big enough to handle enough individuals coming into, maybe it be the restaurants, maybe it be the, some of the gyms and things like that, along with the social distancing, to try to gradually get us back up to our way of living. What we can't be, and I say we must be cautious with this, we cannot open up and then close back down. That's not going to be acceptable by none of us.
Right. So we got to do it right the first time.
So if we do it right this first time, and government is not always fast, but I believe it not being fast is a good thing for us. And if we can do it that way, I think we're going to be okay. We'll be able to push through this and do it in a gradual pace, and looking at the number of people that come in and really listening to those healthcare professionals who know what they're talking about, who must guide us through this. And if we, a combination of all of those things, but more importantly, and I'll close out with this, talking to each other, seeing what works in our prospective communities. That's going to be the key to moving us past this and being sustainable with our processes.
And I think this is a great foundation of starting that communication amongst all of our cities throughout the state. I'll finish up and we'll close it out with Tom McNamara from Rockford.
So again, just really appreciate this time to be with all of you and communicate and hear the different things that you're working on in your community. I would say for opening up, I think there's a number of factors that take place here. Number one, we definitely need the proper amount of PPE we right now do in the city of Rockford for our health systems and for our first responders. But what does that look like for those essential workers? I think the other is we absolutely need enough testing. And then we also need literally an army of contact tracers to be prepared for a full opening. Next, I really think it is, I think what Sam said, you can't open up and close down. So it's definitely going to have to be a phased approach. We wrote the governor last week saying, and by the way, I think JB's done a phenomenal job. I think Dr. Ezike has done a phenomenal job. And so this is no hit on them. I think unintentionally, his executive order benefits larger corporations. And I think unintentionally, that executive order hurts local mom and pop shops. And so I think one of the things that we could do is open up curbside for local retailers as that first phase. It's no touch, no contact opening up of some of these local shops. I mean, it's just hard for some business owners to say, hey, I can go to Target and buy a pair of tennis shoes, but I can't go to a local shoe store that sells them. That it's hard to jive. So I think we can open up a curbside delivery to have that be that first phase, work out some of those kinks. I mean, if our restaurants can be curbside, so can some of these other local retailers as well. So I think it needs to be phased. I also think this idea that every single city should do their own thing, I don't think is a good idea. I think we're too mobile. I think if anything, others mentioned this, some sort of larger regional aspect I could get behind if I had a better idea of what that region looks like. But if it's every single city, it's just way too mobile. We're all the big cities in our area. And so we have so many people who either live in our area and work elsewhere or live elsewhere and work in our area. So that would just be too hard to have so many, 1,300 different rules. Doesn't make sense.
All right. Well, I want to thank Champaign Mayor Deborah Feinen, Joliet Mayor Bob Oderkirk, Rockford Mayor Tom McNamara, Springfield Mayor Jim Langfelder, and Waukegan Mayor Sam Cunningham for joining us today on this session and just talking about what our various cities throughout the state of Illinois have to deal with and how we're working together to address these issues. Now, let me just say, hearing you folks today and seeing you, and I haven't seen you in a while, it gives me hope that I know we're all going to be okay. We're stronger together, as Tom pointed out. Our voices together throughout Illinois, speaking together is stronger than us speaking, individually by ourselves. So let's continue to speak together. Let's continue to give each other hope. As Mayor Cunningham pointed out, let's continue to give each other best practices, good ideas to make our municipalities, our cities, and the whole state of Illinois the best it possibly can be. So thank you guys very much for joining me today. Let's not make this the last time. Let's do this, throughout this whole crisis, because it's going to go on for a while. Right. And I'll talk to you guys later. Very good seeing you. Thank you very much.
Good seeing you, man.
Good
Welcome
to see
back,
you.
sir.
Thank you, brother.
Yep.
Appreciate it.